Hey everyone, welcome back to my series on CPCE practice questions. Today I'm talking about professional orientation and ethics. Feel free to pause this video whenever you need to or play it at a slower or faster speed based on what you need. Let's dive in. A counselor attends a local advocacy event to support legislation that expands access to mental health care for underserved communities. This action best reflects which core professional value outlined by the American Counseling Association. A. Commitment to research-based practice. B. Respect for client autonomy. C. Promotion of social justice. Or D. Duty to avoid dual relationships. And the correct answer is C. Promotion of social justice. The ACA Code of Ethics identifies the promotion of social justice as a fundamental professional value. Counselors are expected to advocate for systemic change and support efforts to reduce barriers to mental health services, particularly for marginalized populations. A refers to clinical effectiveness but not advocacy. B is important in client work but not the focus of this action. D relates to maintaining professional boundaries, not advocacy. A counselor receives an unsolicited gift from a long-term client at the end of treatment. The gift is modest but personal. What is the most appropriate action for the counselor to take? A. Accept the gift and thank the client without further discussion. B. Decline the gift and remind the client that gifts are never permitted. C. Explore the meaning of the gift with the client before deciding whether to accept it. D. Accept the gift but document it as a boundary violation. And the correct answer is C. Explore the meaning of the gift with the client before deciding whether to accept it. The ACA Code of Ethics encourages counselors to consider the therapeutic meaning and cultural context of gift giving before accepting or declining a gift. It's important to explore the client's intent to determine whether accepting the gift would impact the therapeutic relationship, boundaries, or clinical judgment. A may overlook important relational dynamics. B is rigid and may ignore cultural nuance or therapeutic intent. D incorrectly labels it a boundary violation without appropriate context. A counselor in private practice wants to advertise their services online and plans to include testimonials from satisfied clients. According to the ACA Code of Ethics, what is the most ethically appropriate course of action? A. Only include positive testimonials from clients who voluntarily offer them. B. Use testimonials only if the clients sign a written release of information. C. Avoid using client testimonials altogether, even with consent. D. Post anonymous client testimonials as long as identifying information is removed. And the correct answer is C. Avoid using client testimonials altogether, even with consent. According to the ACA Code of Ethics, Section C3B, counselors should not solicit testimonials from current or former clients due to the potential for undue influence, even if the client offers voluntarily. This maintains professional integrity and protects client autonomy and confidentiality. A, still violates the principle of avoiding testimonials altogether. B, assumes consent makes it ethical, but the code prohibits solicitation regardless. And D, fails to address the ethical concern of power imbalance and potential exploitation. A counselor discovers that a client they are seeing in private practice has also begun attending group therapy at the agency where the counselor previously worked. The counselor is concerned about potential dual relationships. What is the most ethical course of action? A, immediately contact the group facilitator to discuss the client. B, terminate individual counseling to avoid boundary issues. C, consult with a supervisor or ethics board to assess for potential conflicts. Or D, ask the client to disclose what is shared in the group for continuity of care. And the answer is C, consult with a supervisor or ethics board to assess for potential conflicts. When ethical concerns arise, the ACA Code of Ethics emphasizes the importance of consultation to protect client welfare and maintain professional standards. According to the ACA Code of Ethics, when is it acceptable for a counselor to break client confidentiality without prior consent? A, when a client refuses to pay for services rendered. B, when the counselor believes the client may benefit from a referral. C, when there is an immediate risk of serious harm to the client or others. D, when a family member asks for the client's progress in therapy. And the answer is C, when there is an immediate risk of serious harm to the client or others. Counselors may break confidentiality when legally mandated or to prevent serious, foreseeable, and imminent harm in accordance with ethical and legal guidelines. Thank you so much for watching till the end. Please hit the like button if you found this video helpful and comment below if you have any feedback. I know ethics is a really tricky subject. Don't forget to subscribe to my channel and hit the bell notification so you'll be notified when new resources like this come out. And I wish you the best on your journey towards becoming a therapist.